agree that nonverbal communication is like 90% of the message. My one reservation is that sometimes there isn't an autoimmune condition.
Yeah.
And there are a lot of other mental health conditions that can cause very similar symptoms. And so when we offer our opinion, many times, not always, but sometimes patients are very disappointed with that. And I can package it as empathically as possible. But like you said, Tiffany, like they're coming in and they want the diagnosis that they know has a treatment for it that's easy, right?
Yeah.
Like I have rheumatoid arthritis. You're going to give me something, and it's going to turn this around in a couple of weeks or months. And that's not always the case. And so, from the physician perspective, it helps when patients are open to the message, especially if we're the fifth rheumatologist and we're saying the same thing.
That's a good point.
That's
a good point.
So, because we're not there to crush your hopes or ruin your dreams, we're there to partner with you and offer you our opinion and our interpretation of the art appreciation data, right? And it's hard for us too to sometimes have these conversations because we want there to be all tied up in a nice little bow, a diagnosis and a simple, straightforward treatment, but that's not reality. That's not the life in which we live. And so I think that's an important part of this conversation as well, not just the physician being empathic and receiving and listening, but that goes both ways. Patients need to also be receptive and hear what it is that we're trying to say, rather than kind of interpreting it in a different way.
That's a really, really great point, actually. And I'm glad that that's exactly the beauty of the show, Rheumy Rounds, and why we do this, because who's going to talk about this in an actual doctor setting? And right. I feel like that makes a lot of sense. And as a patient organization, we do get a lot of patients that come in and feel very disappointed. And I think that's also why many of us, when we finally get a diagnosis, we feel relieved. There's this sense of almost happiness. And so that's a very good point. Thanks for bringing that up. Kerry, sorry, go ahead.
I was just going to say, just like kind of brainstorming, I wonder if there's some way for patients who are new to this journey to help them maybe reframe that sense of like relief or satisfaction with a visit, more so on, was I listened to? Was I heard? Rather than, did I get the answer that I was looking for? Because sometimes, Kerry's a great example. It took 8 years to figure out the right answers, and it can take a lot of time. And if that's the end goal, it can maybe be dissatisfying, as opposed to, have I found a partner that will at least walk on this journey with me?
Yeah, and I think, so two things that I think to kind of pinpoint, to piggyback on that. One word that I heard you say a few times is that you're partnering with your patients, and that is something that I think is, sadly, in my personal experience, I would say rare, but really, really important. That it's not a matter of, we come to you, you tell us what to do, we do as you say, end of story. But it's a matter of, we're going to talk this out, and we're going to try and do the best we can to figure out what might be causing any of the things, what we're looking for out of this visit, and what is our best path forward. And, I think that's really important. And like you said, there, the other thing I wanted to kind of point out, is, you said, we all kind of know that this isn't always an easy, and there's not always an answer. It might not be an autoimmune disease. It might not be, something that we can look at and say, here, X, Y, Z. And while that is what we're looking for, obviously, is an answer and a solution, when that's not there, it's coming back to that inflection and that communication. It's, if I come in and I say, look, I'm sure I have rheumatoid arthritis. This is the treatment I should have. Here's why I think so. And you just say no, that, then we're going to have, a problem. I'm going to come away from that feeling very negatively about that experience. But if you explain what it is you're seeing, what it is that you would be looking for that would lead you down that direction, it's really just, the more information that you could offer in both in terms of what you're seeing and in terms of what you're not seeing, that helps us to say, okay, where do we go? Where does that leave us and what do we do next? And if I could just add in that one other point, I think is so important is that what do I do next, or where do we go from here? Because one issue I've had with a lot of doctors, and sadly I know a lot of other people who have as well, is we come into the doctor and we say, I have XYZ symptoms, and they say, oh, okay, so we will do, ABC tests. And then they call us up and they say, great news, A, B, and C were all negative. You don't have that. Have a nice day. And then we're stuck. Because, okay, it might be good to know that we don't have those particular conditions. Those might have been scary, and it might be, a relief to know it's not that. But we're not done. We're still sitting here with those same issues that we came in with. And if the doctor is done and thinks that's the end of the conversation, it just kind of leaves us hanging. And so having that, here's why, and here's what we can think about now. Here's what we can look at now. Here's, some other things that, we can kind of monitor for.
Did you want to respond to that, Lisa?
Yeah,
I had something
didn't
to
know
add.
if I saw you writing. I didn't know if there was another question coming. So I think that's a great point. And I think, I'm probably guilty of that myself sometimes, because in our mind, like we're always worried about ruling out or making sure that it's not either a complication of an autoimmune or auto-inflammatory condition from medication, something new. And then when all that comes up negative, then what do we do? And usually then it gets to the point of we don't know the answer. I don't know why you have it. Good news, all the scary stuff was negative and it wasn't that. And so I think also that probably, and this is an excuse and not a good reason, but it probably also just comes from trying to be efficient and lack of time, closing the loop and circling back. And so if that ever, I try, when in those situations, when I give the results, I try to say, are you still having whatever symptom it was? Or give advice like, what I worked up was negative. I recommend you follow up with your primary care physician because I don't think this is related to your autoimmune disease. But if that doesn't happen, I really do hope that my patients reach out and are like, okay, Dr. Zickuhr, hey, remember what are we going to do next? Because it may have been just that I missed on a detail. But that's a really, really excellent point. And I don't think anyone's intentionally trying to leave you hanging. And I definitely wouldn't want to do that. And so it's something that I can work towards being better at.
I think that in a lot of cases, people like myself, for example, I have never had a positive lab in my life, ever. Everybody tells me you have perfect blood work. And that is a challenge. We hear that so often. And it's got to be just frustrating too, as a doctor. You obviously want to give answers and you're running all of the tests. And that leads back to this whole, the patient feeling like no one believes me because I'm feeling this, but no test is detecting anything that's happening to me. And so I circled a big word that kind of summarized, I think, what you were both talking about. And that's really information sharing. And there's so many contexts that fall under that. And I think when we're thinking about times that we've had good experiences, with the rheumatologist in the office, it often revolves around good information sharing. The doctor is providing us with explanations, like Kerry said, okay, this is why I might not think it is this, or this is something maybe you should go learn a little bit more about. This could help you. So good information sharing. And I think at the same respect, when you don't have good information sharing and you're left with a lot of questions, or the time, and there's not follow-up between the portal or whatever that is, that lack of information sharing, I think, can be extremely detrimental and can really shape that what is good and what is perceived as bad.
And if I can just add one thing, kind of flipping on the other side, I think we as patients need to take a little bit of responsibility for that ourselves too. Just as an example, my mom growing up, my mom, my grandmother, anybody, like people, they got sick, they went to the doctor, they got this medication. That's all there was to it. And if I was asking my mom, what happened? What did they say about this? And what do you need to look out for? And do they think it could be related to that? The answer was very often, I don't know. Because if the doctor wasn't offering that explanation, she wasn't asking for it. And, years ago, I also wasn't asking for it. So I've had, some medical issues in a different area that I now wonder if, how much was the stuff I was dealing with in college, how much is that related to the other issue that I had when I was 30? And I don't really know, because I didn't ask questions back then. So there's all that information that I don't have and can't get from 20 something years ago. But, it's because I didn't think to ask. I didn't realize how important it was for me to ask questions, for me to try and find out and learn all I could about whatever it was that I was dealing with in my body. And so I think absolutely we want our doctors to offer as much information as they can. But I think we also need to take it upon ourselves to make sure we ask the questions that are weighing on our minds. If they say, here, I want you to take this medication, ask about it. What is it going to do for me? What is it going to do to me? What side effects should I look out for? Anything. We have to remember, if we want them to think of us as partners and working together to come up with solutions, that means it's also partly on us to come up with the questions too.
I think that's great because it helps a lot. From a physician perspective, there's so much I can tell you, right? I can just cite the doctor version of Wikipedia, and for some people, I'm going to lose them if I do that. And so it helps us so much when you come with specific questions, so that we can give you the information that you specifically are looking for. I think the other part of that is, sometimes these conversations are just best done in person or in a visit setting. And so oftentimes when I have patients that have lots of questions, that's what I do. I'm like, let's schedule an appointment so that we can talk about all of this, because then you have my undivided attention, and it's so much easier to check for understanding and like do the back and forth with clarifying questions and all that in person or over the phone than it is in a portal or trying to write it all out. And it gets complicated. And so that's the other thing that my practice is, and that I hope that my patients have actually like started to adopt. They're just like, I made an appointment because I have all these questions. Like, yes, perfect. And I think that is, it's just a really great way of simplifying and streamlining and making sure that you get the information you need and when you need it.